Who actually has time to read research articles? Let's break one down. Today I read this article, and here's what I got. Blood pressure is the major modifiable risk factor in diabetes, but what's the target we should aim for? The 2008 ACCORD trial did not find a difference in outcomes between intensive and standard blood pressure control. However, this study has been criticized due to being underpowered and did not count for proper glucose control. From the results of the 2015 SPRINT trial, intensive blood pressure targets in those without diabetes reduced cardiovascular events and mortality, but current guidelines lack blood pressure targets for patients with diabetes. A 5-year study from China in patients with type 2 diabetes, hypertension, and increased risk of cardiovascular disease addressed the flaws from the ACCORD trial. There was the intensive blood pressure group targeted at less than 120 and the standard blood pressure group targeted at less than 140. Primary outcomes were non-fatal stroke, non-fatal MI, heart failure, and cardiovascular related death. They found that there were fewer events in those with intensive blood pressure control. However, there was higher rates of hypotension and hyperkalemia. So what's my take? I think the study further emphasizes the importance of intensive blood pressure control, especially in patients with type 2 diabetes, in preventing cardiovascular events.